So what do you look for? So just like with lymph node, or really anything on your dog, changes from one to another. Anything that changes, whether it's in size, shape, consistency, or color, is important to know, because something that has remained static or the same for, let's say, 6 years in a row is likely going to be less of a problem than something that changes sometimes right before your eyes, where it gets red or ulcerated, or grows and shrinks. Something that changes is going to be a little bit more concerning. The things that you want to look for in particular, ulceration or bleeding. So if a mass starts out as not ulcerated or not bleeding and then starts to bleed or starts to be ulcerated, then that's something that you probably should have your veterinarian evaluate. If something was small, like a centimeter or a millimeter, and you touch it and play around with it and see what it is, and all of a sudden it swells up into something that's the size of a baseball, that's probably something that you should have your vet looked at, because it may indicate something that is potentially problematic. If a mass is painful, if you touch it in the dog or cat, in this case greyhounds, are uncomfortable when you feel it, again, it's much more worrisome than a mass that's not painful at all. And again, firmness versus squishiness is the best way I can describe it. If something is firm, it's more problematic than if something is squishy.